My name is Charlie. I went to South Plains College Nursing School. I now work in the Level 1 Trauma Center in the emergency room at UMC. The best thing I think about being out is that you learn something new every day. You're not going to learn it all in nursing school. I probably didn't feel very comfortable on my own until at least 6 months out. So if you don't feel comfortable on week 2, it's okay. You're not alone. You'll learn as you go, and everything will work out just fine. As long as you're in the right unit with the right kind of people, you'll be fine. And you'll just learn new stuff every day, and it'll be great, and you're going to love what you're going to do. You're all going to change lives someday, and I'm so proud of all of y'all. Keep going.
Hi, my name is Missy Dial, and I'm one of the RN House Supervisors at University Medical Center. I would say that my best advice for a new grad is to be willing and able to learn, and be willing to accept constructive criticism.
I'm actually looking into traveling nursing right now. I applied about a month ago online, and a recruiter called me probably about 2 or 3 days later. And she kind of asked where I wanted to go, and I kind of told her the area where we were looking at in California. And you just have to go through all the different types of questions at your skill level. You kind of rate all that you've done. And you fill out like a portfolio, you know, like what all you're interested in, where all you've been, how long you've been a nurse, and what your specialties are, which minor burn right now. And then she puts your portfolio out to different hospitals in the area that you're looking at. And she also gives you, other opportunities in different states if you would like to go to that. And I'm going to go to California and work San Diego in the burn unit.
Okay, I'm Fred and graduated South Plains College in December of '97. Been a nurse in the surgical intensive care unit in the burn ICU since then, man. That's where I started. Anyway, best thing about being out, no more second semester. It's done, don't have to even think about it. Seriously, South Plains prepared me to hit the ground running as far as my clinical skills go, and best thing about being done is actually putting it all to use and putting it together and helping people. So, welcome.
I guess I've been a nurse for a long time, and I think that one of the most important things when you come out of nursing school is to realize that you're here in the healthcare setting, whether it's the hospital or clinics or dialysis or prisons or wherever you choose to work, to take care of patients and their families. And I think there's a bad conflict right now between using the computers and all the electronic documentation and the need to do that to meet regulations and charting guidelines and reimbursements and things like that. And the conflict comes when you also need to be providing hands-on patient care, because a lot of our patients are seeing conflict. When the computers are in the room, they think that they're talking to computers. And so you really need to be careful that when that piece of electronic equipment is in the room, that the patient is the focus and not the computer. And if they can master that nowadays in time management skills, I think they'll have a real advantage.
Well, the first thing I did was did some research in my local area. I contacted my hospitals that were there, and I spoke to nurse recruitment. That's pretty big. You want to look at your hospitals around you, speak to the directors, nurse recruitment, whatever you can do to, if you have a foot in the door. For myself, there was no jobs in the area. It was back in California, and it's really tough out there right now, especially with the economy, and hospitals were downsizing. The roles were blending. They phased all the LVNs, and they made RNs take over. So it was pretty limited for me, but I was continuing work as a waiter, and upon that I ran into a doctor who I was serving, and he basically hooked me up with a home health position. So, I mean, you gotta look outside your resources.
The crazies are my favorite.
My advice to new nurses is to remain open-minded wherever you decide to work, and try to experience everything on the unit you work at, because you are never done learning. My favorite thing about nursing is the paycheck. No, just kidding. I like to get my patients back to the quality of life they had before they were admitted into the hospital. Good luck!
I'm Katie Arts, and I'm a breast surgeon, and my advice to you is just to be receptive to education and lots of new learning environments, lots of people to learn from. And just remember, everything you do, you're going to be learning from all different types of people. You're learning from physicians, your colleagues, the nutritionists, everyone who's there, you can learn something.
Go for it.
If I had any advice for new graduates, I would say that patient care is always first, no matter what. And also I would say prioritizing. If you've got somebody with a low blood sugar and you have somebody that needs to be fed, you would take care of the person with the low blood sugar first. Delegate to your nurse aides, because they can help you, but also you help them. You are a team, and that's all I have to say.
Hey guys, congratulations on making it this far. When I graduated from South Plains, I was one scared little puppy. Took me 6 months to get settled down, but all I can tell you is study your skills, know your skills, and work hard on your meds.
You know, we're really never on our own. Like, we always have a team dynamic here. Everyone helps each other. You're going to be nervous, of course, but everything comes back into your mind from nursing school. You know, slow but surely, you know, things will start triggering. You know, start remembering things when you're on your own, and you can always ask people for help. You got a lot of resources.
All the nurses are here to help you learn, help you grow. Nursing school is kind of to put the foundation there, but when you get your first job, they're there to help you build on that foundation. You will encounter many different people with many different knowledge levels and expertise. Everybody is here to help you learn and grow. Don't take offense if people give you criticism or say you did something wrong. You're trying to learn, and just be positive and say, thank you for teaching me. I will try to do better next time. Everybody is here for the good of the patient, and that's what we want you to be, a good nurse. Thank you. I don't know.
I just think students need to be able to just go up to somebody and say they don't know how to do something. And don't be afraid to get your hands dirty. You know, every opportunity is a learning opportunity, and you're not going to learn if you don't get out there and do it. So don't be shy.
Advice is to coordinate your thoughts, make sure you have what you're going to ask the doctor, and then also talk to your colleagues and see who else has questions. So page the doctor once, ask 5 or 6 questions, and then move on.
You really don't learn until you're on your own, thinking for yourself, and just take that into consideration that your nursing begins when you're on your own. You know, I know nursing school prepares you, but you're never going to know that feeling until you're there, the one thinking for it and trying to save.
This is Linda from 4 West, and the one thing that I would tell new graduate students to do is keep a journal of your life's journey in nursing. Write down the crazy stories, your favorite patients, and keep all of that, because someday you're going to want to look back on it, and that's what makes you who you are. So keep that journal. The stories are fabulous, and you'll see how far you've really come. Congratulations.
Why did she switch positions? Cut it off, because you're...